Hello friends, welcome again to my channel where we discuss the science behind this world of medicine. So today we are going to discuss about what we call as the urinary calculi, renal calculi, nephrolithiasis, or most commonly as kidney stones. Kidney stones are stones which are found in the genitourinary tract. Now what exactly is this genitourinary tract? The genitourinary tract consists of principally the two kidneys, which are basically the filtration mechanisms of your body, which filters out the impurities in the blood. This is where the urine is formed, the kidneys. This urine now traverses through the two ureters to the urinary bladder, where the urine is stored until the bladder is full. When the bladder is full, there is a reflex that tells us that the bladder is full, there is pain, there is sensation, and you finally go to the washroom to empty out your bladder through the urethra. So the urine finally passes from the urinary bladder through the urethra. So this is the genitourinary tract, and stone within this urinary tract would be nephrolithiasis, or basically the renal calculi. Stones have this path to traverse. Now what happens is, the main function of kidneys, like I said, is to purify the blood or wash out the impurities from the blood. So what it exactly does is, it excretes out the impurities dissolved in water, which is now called as the urine. Now what happens is, these impurities are generally dissolved in water. However, when the concentration of these impurities increase, what happens is supersaturation. There is supersaturation when the impurities or the concentration of the impurities increases in the urine or the water which is being flushed out by the kidneys. Now, if this supersaturation happens, what happens next is crystallization. And too much of crystallization eventually leads to a formation of stone. This stone, which is formed in the kidneys, can travel through the ureter, urinary bladder, urethra, get impacted anywhere, can stop anywhere and cause the symptoms. Now what exactly are the symptoms? This urinary kidney stone, which is formed in the kidneys, may eventually get impacted or may stop or may obstruct at the kidney ureter junction, or within the ureter, or at the junction of the ureter with the urinary bladder. When the kidney stone gets impacted at this position, it causes urinary retention. So urine beyond this is not able to pass, and this causes stasis of urine. So there is feeling of urine frequency, urine urgency, and there is renal colic pain. What exactly happens in renal colic pain is, the pain comes and goes, there's acute pain. Why does this acute pain happen? The stone is impacted somewhere. It is obstructing a path and it is causing urine to have retention before that path. And when the muscles start to contract, the ureteric muscles start to contract to release the stone. This is called as hyperperistalsis. When the muscles contract, what happens is, you feel the renal colic pain because they are exerting too much. And obviously the impaction of the stone in the ureter also awakens the pain sensation in these smooth muscles. So what causes renal colic is, the pain sensations in the impacted zone are awakened, and the hypercontraction, hyperperistalsis of the muscles of the ureter to eject out the stone causes the renal colic. This renal colic is basically happening on the upper back side, right or left side, based on the stone position, and can travel to the anterior lower side. So it starts from the flank region, may travel to the anterior part of your body, and you may have pain throughout the urinary tract. So it is felt as a somatic pain. It is felt as a pain from the flanks up till here, can be anywhere. So this is the renal colic pain. Now, as I mentioned, when there is retention of urine, the urine which is impure may also cause, the retention of urine may also cause infection. So this is another complication or another symptom which the patients present with. They have infection. So urinary impacted stone may cause infection because of urine stasis. Then what happens is, in some cases, what may happen is there is hematuria, which is blood in urine, because these stones may damage the walls of the ureter or the kidney or the bladder, and hence this may cause hematuria, which is blood in urine. Now, next symptom which is there is increase in urinary frequency or urinary urgency. When the urinary stone comes in the bladder, what is happening is it is impacting the wall of the bladder. When there is impaction on the wall of this bladder, it causes a feeling of urine. So because bladder wall gets distended, it's irritated because the stone is constantly impacting the wall. So there is feeling of urine frequency, frequent urine, and because this stone may also obstruct the path of the urethra through which the bladder gets emptied out, it may also cause urine to stay in the bladder and not empty out fully, leading to again a feeling of urine sensation. Just after having one bout of urine, you may have again urine sensation. So this is called as increased urinary frequency. And when this stone is obstructing the path of the urethra, it may also cause pain during micturition, or what we call as pain during urination. So these are the most common symptoms of renal stone. Now, what are the types of renal stones? The types of renal stones basically are the calcium oxalate renal stones, which are the most common kinds of stones. 80% of the people presenting in the clinics with the stones are presenting with calcium oxalate stones. Then can be calcium phosphate stones, uric acid stones, cystine stones, which is basically due to a genetic disorder, or struvite stones, which are basically due to a urease bacteria. This is due to an infection which causes stones which are called as the struvite stones. Now this is okay, you know what are the kinds of stones, you understand the anatomy, you understand the physiology of renal stones or the kidney stones. Now what is it that actually predisposes you to a kidney stone? This is the most important part of this video, which actually tells you what actually predisposes you or is a risk factor for kidney or renal stones. And trust me, the first and foremost factor is dehydration. Almost 98% of the people who present to the clinic with a renal stone have had a history in the past of having less amounts of water. So yes, fluids, decreased fluid intake, dehydration is one of the most common predisposing factor to urinary stone, and you can easily appreciate that the most common or the most important thing that you should do to avoid a renal stone is to keep yourself fully hydrated. Hydration is not a particular amount of water. It is determined by the amount of water you are sweating out. So a person who is doing a more physical labor needs more amount of water. A standard individual who's working in an office environment may only need 2.5 liters of water per day, but that same requirement may be 4 liters or 4.5 liters per day for someone who's doing work in the sunlight. So you need to keep yourself fully hydrated. The second is high salt diet. High protein diet also predisposes you to uric acid stones. Then low calcium. Calcium should be consumed in average amounts as recommended by the Dietary Association. Low levels of calcium cause predisposition to oxalate stones because it interferes with the dissolution of the oxalate chemical or the oxalate in the intestine and the urinary tract, and hence low calcium also predisposes you to calcium oxalate stones. Even a high amount of calcium is not good because it again predisposes you to the stones which are basically the calcium stones. So hence calcium should be consumed in an average recommended daily allowance manner. Now next is something that you cannot do anything about is the male population. The male population is predisposed genetically to kidney or renal stones. A low urine pH or a very high urine pH again predisposes to renal stones because it causes supersaturation. So urine pH should be maintained within the average range of 6.5 to 7.5. If the urine pH is too high or too low, again it causes supersaturation, crystallization and stone formation. Obesity is another risk factor which predisposes to renal stones. Low citrates in the diet also predispose to calcium oxalate stones. And then antacids, the medications for acidity that we generally consume over the counter, are also not good and one of the predisposing factors for renal stones. Now you appreciate what are the reasons behind the renal stones. Obviously there are other reasons which are beyond your control, but these are the reasons or the causes which you can control except for the male population one. And what you can do is, at the outset, just from after the video, what you can do is start consuming lots and lots of water each day to at least avoid one of the biggest cause of renal stones, which is dehydration or lack of water intake. Now, when we come to the treatment part of it, the treatment part of it is divided into a medical intervention and a surgical intervention. A kidney stone, renal stone, which is less than 5 mm in size, generally passes through the urine to the outside world and it can easily get excreted out. The renal stones generally are diagnosed through an ultrasound, which will tell you the size, X-ray, and the gold standard is CT scan, because uric acid stones are easily seen on a CT scan but not on an X-rays. But yes, the stones less than 5 mm can pass easily. For a bigger stone or stone that is impacting, what a doctor may prescribe as a medication or as a therapy in terms of medicine would be high amounts of fluid intake. They may prescribe you some Ayurvedic medications that are available. They may prescribe you smooth muscle relaxants. So these smooth muscle relaxants, basically tamsulosin is one of them, which basically expands the ureteric wall. So when that expansion relaxation happens, it gives path to the urinary calculi or the stone to pass through. So when the tract increases, the ureteric tract increases, relaxes, there's space for the stone to pass. So this is one of the medication. And the other is citrates or alkazol syrups, which actually make the urine alkaline and help sometimes in dissolution of stones, especially the uric acid stones, which can easily be dissolved with potassium citrate added as a medication. But yes, this is not 100%, but yes, in some cases it does dissolve easily and helps in passage of stone through the urine or dissolution. Now, if the stone is more than 10 mm and it is not dissolving, it is highly unlikely that it will easily pass through and may require a surgical intervention, which involves either a shockwave lithotripsy, wherein shock waves are given from the outside to break down the stones, or percutaneous nephrolithotomy, in which there is a small incision through which the stone is broken down and then excreted. And the third can be through a ureteroscopic method. Through the urethra, the stone is removed from the bladder. Obviously, there may be another surgical intervention which may have come up of late, but yes, these are the most common surgical interventions. But you need not worry about them. You can leave this to the experts, to your doctor, to your surgical intervention can be left completely to your doctor. What you need to remember out of this video is what predisposes you to kidney stones, what you can do about it, and you should have a general brief idea about what exactly are the kidney stones, what are the symptoms, and how you identify yourself that you may be having a kidney stone, and you can take proper action, visit a clinician in an optimum amount of time at the exact interval when needed. So friends, this was a long video, but I hope this was useful, because renal stones are something that is a gray area for a lot of people. People talk a lot about it, but you should understand easily that yes, what are the renal stones. And I hope this video was useful. If yes, please like, share and subscribe, and don't forget to watch my next video. Thank you.